alaikum. I'm Dr. Hasiba Mahmuda, Assistant Professor Current Charge, Department of Microbiology, Bashundhara Ad-din Medical College. Today I'm going to discuss about a topic of the mycology. In our previous session we have already learned the introduction of mycology or fungus. Now today we will discuss about the classification of fungus. The classification of fungus is based on two categories. One is a morphological classification, another is clinical classification. Now first we will continue with the morphology of classification of fungus. According to morphology, fungus is of four types: yeast fungus, yeast-like fungus, mold fungus and dimorphic fungus. And in the next session in the next slides we will discuss about that. Yeast. What is yeast? It is the unicellular fungus. The shape is oval or round shape, and the reproduction is caused by production of budding. Example is Cryptococcus neoformans, which is the only pure yeast that causes and which is responsible for doing the meningitis, especially in the immunocompromised patient or AIDS patient, etc. Here is a picture of these two yeast or Cryptococcus neoformans. In the left sided picture we can see that there are two pictures in the left side, and it is the media, it's a culture media, which is the SDA plate or severoid dextrose agar media, and there is a growth of the colony of Cryptococcus neoformans. This is the growth of the colony, yellowish growth, mucoid color. And in case of right hand side there are two pictures showing it is the microscopic view of Cryptococcus neoformans. It is showing that there is formation of budding yeast which is surrounded by the unstained capsule. Here there is the preparation is done by the Indian ink. Indian ink is a negative stain which doesn't color the whole fungus, it only colors the background, and the capsule of the Cryptococcus neoformans is not stained by this. So it's a negative stain. By coloring the background, and there is unstained capsule, and there is unstained capsule surrounding the oval or budding yeast. It's called, so it is the typical structure of Cryptococcus neoformans under the microscope. Now the second type is yeast-like fungus. Yeast-like, it is also unicellular. It is round or oval in shape. The reproduction is caused by budding. The budding in all joined together to form, by the process of budding, all joined together to form the pseudohyphae. Example is Candida species. Here the Candida is not pure yeast because it forms the pseudohyphae. Due to production of the pseudohyphae, this yeast is not the pure yeast. It is called the yeast-like fungus because due to formation of pseudohyphae, it is termed as yeast-like. Here is the picture of the budding yeast with pseudohyphae. Here you can see that there is a formation of budding around from the yeast, and there is formation of the pseudohyphae. There is an example of the Candida species. In the first picture is the ischematic picture of Candida species, and the last two pictures, in the left hand side we can see the wet frame preparation of Candida species. Here we can also we can see the budding yeast with pseudohyphae, and is the gram staining procedure. The right hand side, the gram stain procedure of the sample, or which is showing the presence of budding yeast with pseudohyphae also. Now what is the mold fungi? Mold fungus are multicellular fungus. The thread-like, they have the thread-like shape, and they are elongated. Thread-like growth of mold fungus are called the hyphae. Most fungus are actually in hyphae form in the environment, or which causes disease. Around 250,000 of species of fungus are present in the whole world, among which only 200 species are pathogenic for human, that causes disease and in human. Most of them are opportunistic, cause disease and immunosuppressed or immunocompromised persons. Now molds, examples. As we have already mentioned that most of the fungus are in mold form, Examples are dermatophytes, Aspergillus species, Penicillium species, Mucor species and Rhizophore species. In this picture we can see that there is two types of hyphae there. One is septate and aseptate hyphae. Some molds are aseptate and some are septate. Example, in case of, we can see the picture of two molds, Aspergillus species and dermatophyte species. In case of Aspergillus, there is a formation of hyphae, and in apical portion there is a sporangium formation and spores are formed here. And this is a septate hyphae. Aspergillus is a septate example of septate hyphae, so it's also included in the mold. And here we can see the picture of the dermatophyte. We can see the septate branching hyphae with micro and macrochoridia in case of dermatophyte. These are also mold. Now, the last type is in the morphological classification. The last one is the dimorphic fungus. Dimorphic. What does it mean? Di means two and morphology, that means this fungus has two morphologies. And two morphology in two different temperature. One is in our body temperature or 37 degrees Celsius, this fungus shows the yeast form, and in case of room temperature or 25 degrees Celsius, it shows the hyphae form or mold form. Example is Histoplasma capsulatum, Coccidioides immitis, These fungus show two morphology in two different temperatures. So these are called dimorphic fungus. But there are some fungus also which shows two morphology but not in two different temperature, such as Malassezia furfur and Candida species. They can also show two morphologies, but in same temperature they can show that. So if mold and yeast form grow at the same temperature like Candida and Malassezia, so they are not called the dimorphic. They have two morphologies but they are shown in the same temperature. So we cannot tell them dimorphic. We only tell the fungus is dimorphic that have two morphologies in two different temperature. In 37 degrees Celsius, it shows the yeast form. In 25 degrees Celsius, room temperature, it shows the mold form. Achha, the clinical classification of fungus. Based on the site of infection, the fungus are classified into four types: superficial fungal agents, cutaneous fungal agent, subcutaneous fungal agent and systemic fungal agent. Superficial fungus agents are the agents that don't use the keratin portion. Cutaneous fungal agent use the keratin. So then subcutaneous fungal agent and systemic fungal agents are divided into two parts: the primary infections and opportunistic infection. Superficial fungal agent. Superficial fungal agents infect the outermost layer of the skin, such as stratum corneum. It doesn't utilize the keratin as nutrient. The examples of superficial fungal agents are Malassezia furfur, Exophylla wernicki, Trichosporum beiji, Pedra horti or Horti wernicki, etc. Subcutaneous fungal agent. These infect the subcutaneous tissue. The examples are Sporothrix schenki, Madurella mycetomatis, Rhinosporidium sebaceae. Then the third one is cutaneous fungal agent. It infect the epidermis of the skin, hair, nail, mucous membrane, etc. They utilize the keratin as their nutrition. The examples are dermatophytes and Candida species. The last one is the systemic fungal agent, which is further subdivided into two types: primary and opportunistic. The primary fungal infections that cause the systemic mycosis in immunocompetent individuals. Examples are Histoplasma capsulatum, Blastomyces dermatitis, Coccidioides immitis, Paracoccidioides brasiliensis. That means that these fungal agents cause the primary systemic mycosis, primarily infect our body and cause disease. And then another term is opportunistic. That means that infection in the immunocompromised or immunosuppressed individual are called the opportunistic infection. The examples of opportunistic, the fungus are the Cryptococcus neoformans, Candida species, Penicillium species, Aspergillus, and mucus species. Now, the diagnosis of the fungal infection. There are 4 approaches to the lab diagnosis in the fungal diseases, 4 steps. At first, the direct microscopic examination of the sample that is collected for lab diagnosis. Then number 2 is culture of the organism. Number 3 is DNA probe test, and number 4 is serological tests. At first, direct microscopy examination of clinical specimen depends on finding characteristic asexual spores, hyphae or yeast in the light microscope. The specimen is either treated with 10% potassium hydroxide solution to dissolve the tissue material, leaving the alkali resistant fungi intact, or stained with special fungal stains. The fungus are frequently cultured on the most commonly used media for culture of fungus is sebaroid dextrose agar media, which facilitates the appearance of the slow growing fungus by inhibiting the growth of bacteria in this specimen. Inhibition of the bacterial growth is due to the presence of low pH of that media and to the presence of chloramphenicol and cyclohexamide that are frequently added to make the media selective, such as for dermatophyte. If we use the antibiotic like chloramphenicol and cyclohexamide, the media will be selected, and only the dermatophyte, if there is presence of dermatophyte is present in that sample, it will only grow. Other contaminants or other bacteria or fungus will not grow here. Thank you so much for your patient hearing. In our next session, inshallah, we will discuss about the antifungal drugs and fungal toxin and some other infections. Thank you.